This show is sponsored by PowerfulWomenUSA.com, a place to be inspired by successful women. Hey everybody, I'm Jill Conway, and this is Secrets of Powerful Women, a show dedicated to celebrating and supporting strong and successful women and sharing their stories. I'm hoping you will be inspired to pursue your dreams, reclaim your voice, and discover your strengths. So my guest today is Erica Ferraro. She is the author of a guidebook on infertility that is about to make its debut. It's called Moving Mountains for Motherhood, a guide to survive and even thrive through your infertility journey. So Erica, thank you for being here and welcome to the show.
Thank you so much.
So Erica, you sent me a copy of the book in advance, and I can say, as I mentioned earlier, that without a doubt, this is going to be an international bestseller. So I'm going to say congratulations to you first before anyone else gets to say that, because there's truly nothing else like it out there. So let's begin with that. Like, who is this book for?
So this book is really for any person, couple, man, woman, basically anybody who wants to have a child that is having a challenging time doing that, whether that's because they have a diagnosis of infertility, maybe they don't have a diagnosis yet, but they need to possibly consider the fact that they may have one and they need to see a doctor. Maybe somebody wants to become a parent but isn't in a situation where they have a partner, or they're able to do that with somebody else. And so there's a lot of different ways that infertility can be defined. The ASRM has recently updated that definition to be more inclusive of people that have partners, don't have partners, LGBTQ, all of those things. But really, at the end of the day, the book is for anybody who wants to have a child that needs to go about it in a bit of a different way for whatever reason.
So first I wanted to, because in the book you define what infertility is, and I know you said there's a clear definition. It's like if you're trying, what's the definition for that?
So the traditional definition has been if you are basically having unprotected sex with the intention of getting pregnant for more than a year and you are under the age of 35, and if you're 35 years in age and older and you've been having unprotected sex for 6 months or more, at that point it's encouraged that you see a physician. Now,
you talk about, the book is raw, it is honest, it is really talks about the emotional roller coaster ride that infertility, the journey of having a child. So let's talk about what happened and tell your story. So what made you write this book?
So when I guess I should go back. When I got my period at 11 years old, I always had very, very painful periods. And I was basically told by anyone I spoke to, whether it was females in the family, doctors, whoever, periods just suck it up. That was kind of just the statement. Take more Advil, use a heating pad. If you need me to pick you up from school, I will. I remember being a teenager and being very nauseous, having a lot of issues digestively during and around my menstrual cycle, going to the nurse, needing to go home because I literally couldn't stand the pain, sweating profusely to stay in school. So that was my experience with periods my whole life. As I got older, it became this joke between me and my husband that we would have I would have a monthly exorcism because the way that I'd have to contort my body to manage my period symptoms was unnatural, and it would go on, for the first day or two of my period, very severe pain. There have been times where I've been hospitalized for period pain, and it was always just you should take birth control, or you should go take more Advil. It was never, nobody ever said the word endometriosis to me. I went to multiple different OBGYNs and that was never said. No one in my family ever mentioned it. So I found out through trying to have a baby with my husband that I had endometriosis, but quite honestly, I had every symptom presenting for so long that I probably could have been diagnosed many years ago, which then would have allowed me to have had proper care earlier, which could have resulted potentially in not being sterile. It could have definitely resulted in me not having to live with these horrible symptoms that affected my life. And I also could have done things like maybe egg freezing or other preventative type fertility care things earlier on in life. So that was really kind of what happened to me is I had stage 3 endometriosis, and I didn't find that out until I started to try to have a baby, and we were not getting pregnant. We obviously tried the natural way for over a year. I brought it up to my new OBGYN at the time, who brought up endometriosis finally at 29 years old.
Wow.
Conducted the laparoscopy procedure, surgery. That is the only way to fully diagnose endometriosis. You can't really see it on scans. So even though they'll do an MRI and they'll do scans to determine if you have it, you really can't see it until it's in late stages. And even then, the golden standard for diagnosis is through that procedure, that laparoscopy. So what was supposed to be like an hour-long procedure was like 4 hours. I woke up, found out that they had basically taken endo from my colon, all the different parts of my pelvic region. I had 32 internal stitches. I lost my appendix.
Wow.
And I was just happy at that point when I woke up to even like have ovaries left. And the doctor said, you had lesions on your ovaries. We chose to drain them. I didn't want to cut them out because I didn't want to further prevent you from having fertility issues. But, a lot of women that have the endometriosis on their ovaries do tend to have diminished ovarian reserve, which basically means that the inflammation from the endo and the constant scar tissue buildup of that blood release each month with nowhere to go, it basically contuses your organs, and it creates a lot of gunky scar tissue, and it can cook, roast, ruin, however you want to call it, your eggs. So he said, you probably have quite an aged egg reserve at this point. I would go see a fertility doctor to see what's going on. So that's when we found our fertility doctor here, actually out of Woodbury, New York, Dr. Stephen Palter, and he was the one that diagnosed me with diminished ovarian reserve through blood work and testing. And it's very consistent with somebody who has endometriosis to potentially have that. And so we did multiple rounds of IVF to get out the eggs that I did have left to see if we could make embryos, if I could have genetic children. And I think in a matter of 2 IVF cycles that we did, and a platelet-rich plasma therapy that we invested in, so we really threw everything at the wall, we never could make a single embryo. And so that's when then we decided to consider third-party reproduction to have children, which was through the use of an egg donor. And that was really when my blog kind of came to life, because I was having a really hard time emotionally processing the loss of my genetic loss, basically, at 29 years old. So...
And it was obviously it had to have been such a shock to you, right? Because we were talking earlier, in the book, you'd go on to be what is a normal period and what is an abnormal period. And I just want to say, you're not a doctor, but you interviewed, there's 6, 7, 8 doctors in there who joined with you in writing this book. And there's tips and advice and everything like that. But so what is a normal period from what you've learned from the doctors, and what is an abnormal? And I was shocked to learn that painful periods is not normal.
Yeah, I was able to learn through education, through doctors, that periods should not be painful, but then also after my laparoscopy surgery, when all my endometriosis was cut out of me, the first period I had after that, I didn't even know I was getting a period. There was no pain at all. I didn't need a heating pad. I needed no Advil. I'm currently on birth control to suppress the growth of endo in the future, because we would like to have future children. But if I wasn't on birth control right now and I just had a period, I would just have a period. I wouldn't really feel it. And that was the most shocking thing, was being wait, this is how it's supposed to be.
Right.
So yeah, extreme pain is not normal. If you have pain, you need to bring that up to a doctor and mention the word endometriosis for sure.
Wow, I had no idea.
And March is Endometriosis Awareness Month, actually.
Wow. So which is exactly endometriosis? Is the overgrowth of what?
It's basically displaced uterine tissue. So for some reason, when some women are born, the blood-shedding uterine tissue that's within your uterine wall is found elsewhere. And actually, they have found it all over people's bodies. In very rare cases, they found it on people's brains, on people's lungs. It can be actually anywhere, but it's typically displaced in different parts of your pelvic region. A lot of women that undergo laparoscopy surgery do end up losing their appendix, having it taken out of their colon. Actually, a lot of IBS and gastro issues tend to be misdiagnosed when it's actually endo. So that's something I've been advocating for a lot with friends of mine that have gastro issues that are unresolved, just to bring that up. Could this be an option?
Sure. So you have a beautiful child. So you what's amazing to me is that you wrote this book, but not with the intent of writing the book. It kind of came out from all your blogs and things like that. But I want to talk about the process that you've been through. And you mention in the book how this journey and this diagnosis really changes your relationship with your husband and with your family and with your friends. And I want to talk about more about that, because I don't think people, really talk about that. Mm-hmm. How did it affect your relationship, let's say first with your husband?
Yeah, that's why I wanted to create this book, to show that side of things, the romantic impact, the friendship impact. Mm-hmm. Stress under relationships, I think, is the name of that chapter. But there's a lot of information out there about all of the medical stuff, but what about the emotional side? Yeah. And there's nothing that puts them both together. So that's what makes the book unique. But to directly answer the question about with my husband, when you take sex out of making a baby, mm-hmm. It changes everything. It's not as intimate. It's very scary. You start having conversations well, what if we can't have kids? Well, I'm the reason we can't have kids, right? Mm-hmm. You find that out through your process of elimination with the doctor. Some people it's, the husband, some people it's the wife, some people it's both. That happens mm-hmm. a lot too. Mm-hmm. In our case, it was me. So then you start having questions of should you not be my husband? Like, could another woman give you children? Like, it just like creates like a lot of doubt and questions and insecurities, I think, for the person that is the infertile one. I think for my husband, you know, being the one that wasn't infertile, it still to him felt like a failure, as he speaks about a little bit in a sense, because it's like our fertility, right? Like, I married you to have children with you. So it's our shared fertility. And of course, like, the second that you can't get pregnant, everyone else is. So there's like that piece of it too, that, you know, we're both managing. And it was, you know, it was an interesting experience for sure to go from like, we can't just have sex to have a baby. Okay, now we have to see a doctor. Okay, now I actually can't even have genetic children. So like, now we're talking about adoption, not having children at all, using another woman's eggs to get pregnant. Like, I had to obviously process that a lot, because there's, you know, a lot of stigma and just like a lack of education around some of these third-party reproduction options, which is why I'm like, this book needs to encompass a third-party reproduction chapter that highlights and showcases the real stories of people that have gone multiple different routes to have children. Because the one feeling I never want another person to feel that I experienced is feeling like backed into a corner and optionless. Because when you feel that way, you can get very dark mentally. That's when people feel hopeless and desperate, when they feel like they don't have options. And for me, not having children was not an option. I wanted that. And feeling like the only options could have been basically don't have kids or consider adoption, which has its whole own, you know, range of things you need to be willing to kind of work through. I was like, I guess we just can't have kids. Like, what's the option? And it made me feel very dark. And so I want people to know that read this book, that if IVF doesn't end up being the catch-all for you, because it's not for most people. IVF is a chance at a baby. It's not a guarantee at a baby. If IVF doesn't work, you actually still can have a baby through multiple different means.
Right.
And you do have actually a lot of options, and you don't need to feel hopeless.
Well, it's funny, in the book, you write, in just the introduction, you say, I'm not going to sugarcoat it. Infertility is a beast. And then you say, I have been where you are. I have cried those tears. I have felt that frustration. I've spiraled into complete and utter emotional darkness and wondered if I would ever make it out, but I did. And so can you. Gosh, Erica, I mean, I don't think I sit here and you talk to me about it, but the emotions that you must have gone through, because there is in the world, you know, people and your family, they try to be comforting, but does it work? And then it's almost like, I would think, and from the book, is you want to take on this feeling like, it's me, you know, and I'm all alone.
Yeah, I think what makes it really hard is that you also want to have other people have certain experiences too. Like, okay, I'm having this medical challenge, but like, I want my husband to be a father. I want my grandparents, like my parents to be grandparents. I want my brother to get to be an uncle. I want all of us to be able to have this experience of having a child in the family. Like, it's not just about you also feel this sense of responsibility to others. And so,
which is terrible. I mean, that's awful.
Yeah. I mean, it's hard. Like, the thing about the book is that I'm very honest, because like, it is one of the worst experiences like you'll go through. We say worst club, best members, because you don't come out of an experience like this without becoming a much more empathetic, less judgmental, open-minded person. But I think that there's different levels to it, right? Some people may go to the doctor and be able to take a pill and take a shot and get pregnant. Other people may need to do like a full-blown IVF cycle. Some people need to use donor gametes, you know, like
what's that? I don't know what that
like
is.
donor eggs or donor sperm, or even consider like embryo adoption, where they can actually use like donor embryos made from other couples. So I think there's different levels to fertility issues, as well as what you're going to do.
Right.
So I think there's also different like levels to the trauma, and I don't think any is worse or better than the other. I just think it's different. Like, and that was hard too, because you try to find solace within the infertility community. And then it's even like a comparison thing there. Whose treatment works better, who gets pregnant first, who had to use a donor, who didn't. It's like you can't escape it. And so I do actually highlight in the book how to survive within that infertility community, because there's great people and resources online. But even that at times can be like difficult too.
Yeah. Well, what would you say? Because I want to people listening who say, you know, I know someone going through this, because it's not so uncommon. 1 in 6 individuals worldwide experience infertility. 42% of Americans have turned to fertility treatments or know someone who has. So having said that, what can family members say, or how can they address a topic with a couple, you know, a family member that's going through this, that shows that they're supportive without prying or triggering? So what would be, you know, what is something that maybe you were looking to hear, wanted to hear from someone? Do you want them to not mention it at all? Like, what are tell us what what people.
So I wrote a blog
say.
article that's like part of the book, and it's called "How to Not Intentionally Be a Jerk and Support Your Infertile Friends." Right?
Exactly. Right.
So yeah, I mean, I think everybody's different, but I would say generally speaking, I think don't ask people when and if they want to have children. I think let that come organically from them, because a lot of people, especially married couples, I mean, like most people are trying to have children. If they don't want children, you probably know.
Yeah.
So if they're not offering that, I would say don't put that pressure, especially around holidays. Like, don't ask the couple that just got married, when are you trying to have kids? Because they may have had a conversation when they were dating that like, that man may not have viable sperm, or like that woman could have like gone through, who knows, like chemotherapy and she can't use her eggs. Like there's so many variables. Yeah. So I would say that's number one. But if you do know someone that's going through fertility treatments or infertility in general, I think you can just simply ask them, like, what do you need? If you're pregnant and you have an infertile friend, I think you can give them permission to skip out on some of the pregnancy related things. Like, hey, look, you're invited to my baby shower, but if this is triggering, like you and I can just grab dinner and celebrate separately. Like I don't, I think you can give people that out, ask them what they need. Some people want to talk about it and some people don't. They want to hang out with their friends and like dissociate from that a little bit. So I think you have to just ask people what level of support they're looking for.
Right. How long was your journey? Like you said, you found all of this out at 29, and gosh, had we known more about it, because I'm learning a lot from you now, you would get checked, right, at 20, 22, 23, so you could, like you said, maybe take some sort of measures to slow it down or be treatment. But I mean, at this point, it took you how long from when you first found out and you had that surgery to then having a baby?
It was 2 years.
Okay.
Yeah, it was 2 years of like trying fertility treatments. Fertility treatments aren't working, donor egg IVF, and then getting pregnant. And then what's hard about getting pregnant after all that is you can't really even enjoy the pregnancy. Like I said to my friends, the bravest thing I've ever done was get pregnant after infertility, because
so scared.
Because all you think about is losing the baby, because nothing's worked out up until this point.
Right.
And unfortunately, in the infertility community, you do have a lot of recurrent pregnancy loss. You have people with fertility diagnoses, so the miscarriage is very common amongst people in that community. So now you work so hard to have this baby, you're putting a needle in your butt that's like a horse needle, every single day to have the progesterone, in your system up until I think it's like 12 or 15 weeks. You do that for a long time. Wow. So there's so much extra effort that's put into the first like trimester of that pregnancy that it's just like every day you just like are catching your breath. Like I would go to the bathroom and like check, like, am I bleeding? Am I miscarriage? And I've never had a miscarriage before. But that idea that this is not going to work out and something's going to go wrong was always there. And so the anxiety of like just making it to the end of the pregnancy, like I really couldn't enjoy the pregnancy. Yeah. And even sometimes, even now with my son, like things just feel very surreal because I always have it in the back of my mind. Like I really wasn't like naturally going to be able to have children. So the fact that I even had him and he's here, like it just doesn't feel real, but it also makes things just feel like so intensely special. It's hard to explain.
How did your husband feel going through everything? I know we talked a little bit about it as couples, but I mean, like you said, like men, you want to, I think we said it at maybe outside, they want to, because a lot of men suffer from infertility too. So, and in the book you have, I think, questions or something that you said your husband was filled out or went through or whatever.
Yes, I do. My husband does give a perspective in the book, which is really great. I think, in our case, I was the one that had the infertility diagnosis. He didn't. I have had many friends where their husband was the one with the infertility diagnosis, and they do not want their wives talking at all about what's going on. I think they feel, unfortunately, a lot of shame and a lot of lack of support, and I think that's because men in general don't have, like, support groups and, like, blogs and all the open forums and the emotional processing that women tend to have, like, with themselves and with other people. So I do think that there's a lack of male infertility support, which is why in my book I actually have one of the bigger male infertility influencers pursuing fatherhood that writes his perspective about using a sperm donor to have his daughter, because you don't have a lot of examples of that. Right. And even though this book is called Moving Mountains for Motherhood, if you're a woman that is married to a man that has to use a sperm donor, or you have to do IVF because they need to do like ICSI for sperm insemination or whatever that is, you are moving mountains for motherhood. It's not your diagnosis, but you're doing that with your partner. So I needed to have the male perspective in the book. And my husband was very supportive of our situation. He never made me feel weird. He never made me feel like he was disappointed in me or upset. He's a very like logical, even keel person. So he was kind of just like, it is what it is. Like, we're not going to be upset about something we can't change. We did have a lot of conversations about how it did take the intimacy out of our relationship for a bit, as well as the experience of getting pregnant. I mean, an embryo transfer is pretty sterile. It's you, your partner, and 2 or 3 other people in the room saying, okay, done.
Kind of kills the romance of it.
Yeah, there is none of that, but I also think that you get other things out of this experience that without, working really hard to have something, you can't experience.
All right, we'll be back with Erica Ferraro after the commercial break. You're listening to Secrets of Powerful Women. If you love what you're listening to, head to powerfulwomenusa.com for previous shows, or you can find my podcast on whatever platform you listen to. Share this with a friend because this is good. Welcome back. You're listening to Secrets of Powerful Women. Erica Ferraro is here with me, and she's the author of a guidebook on infertility that's coming out. It's about to be released. It's called Moving Mountains for Motherhood, a guide to survive and even thrive through your infertility journey. So welcome back, Erica. I want to talk about, in your book, you mention faith purchasing to cope. What exactly is that?
Faith purchasing is a concept of believing that something's going to happen no matter what. You're going to make it happen, so you're going to buy some things as like a very tangible, real way of saying like, it's happening, so I'm going to prepare for it. And that's how I felt. So I would go to like TJ Maxx or Marshall's and buy a little onesie and buy a little baby toy. It got to the point where my husband was like, do you want me to like put the closet in the future nursery together so you have a place to put things? And I'm like, yeah, because it's going to be a kid's room eventually. I don't know how we're going to get the baby. There's a lot of different various paths we could go down. But sure, yeah, put the closet together. Let's start hanging up clothes. That was really helpful for me because it was like that affirmation that like
it's going to happen.
It's going to happen.
Yeah. I love that because I feel like it's almost like the premise of manifesting. It's like this is happening, whichever way, like you said, whichever way it's going to happen, it's going to happen. So I'm preparing. Well, how did you have family and friends who say like, what are you doing, Erica? No,
I mean, I feel like I had a lot of friends that actually more took the stance of like, you don't have to tell anyone and like, you can keep this. I didn't have anybody like knock the faith purchasing, although I don't know how much they knew about that. But I did have a lot of that. And that stirred up a lot of emotions in me. And it's part of the reason why I really wanted to not only create the blog, but like make this like official. Like this story is going to be, this is it. This is what happened. I'm a mother through donor egg IVF. I couldn't have genetic children. There's things I would have done differently, but there's so much I learned through the process. And it was because I had a lot of people tell me that I like didn't need to share the story. And I'm like, why? And then they would say, well, it's no one's business. It's private. And sure, it is.
It's for sure it is.
For sure it is, but it didn't feel alignment with like me because I'm such an open book person. Like I'm not someone who's super private. So to have something feel like it needed to be a secret, I was getting this sense of feeling like it was like shameful. And I'm like, but it's not shameful. No. And so it helped me own my story by actually being out about it. I completely respect where other people may not feel that way, but I just think if you want to share something, don't feel like you shouldn't because there's a stigma. If you want to share, because honestly, nothing in my life has connected me more to other people than this experience. Yeah. So for everything that I thought I would lose by sharing, like I've gained 10 times more. And I talk about that in the book.
Well, I mean, there's no shame in there. You're right. Or people take on that shame and say there's something wrong with me. But there isn't. There isn't something wrong with you. There's something going on that can be, you can figure out a solution.
Infertility is a medical diagnosis, right?
Yeah.
So you wouldn't tell someone who has Crohn's to not tell their friends that they can't go out or they can't eat that because, they have an immune disease and like someone that has cancer, you want to be there to support your friend. Infertility is a medical diagnosis, and there's many reasons why you're experiencing infertility, like various, and I talk about that in the book with the doctors and the experts, but it's a medical issue.
Right.
So I think the more that we hide what we're going through, we're kind of just almost feeding into this narrative that it's not. And it's something that you're doing, and it's
exactly
not. It's not. Some of the most healthy, wonderful marriages, couples, partners, whatever, experience infertility. It's not you're not having sex enough. Oh, you're not supposed to be a mom. The rhetoric around that is really hard. I think owning what you're going through, it can help you process, but it also makes it easier for the next person. That's kind of
Well, this, you talked about, like, you had never intended to write this book, and you started a blog, as you said, to kind of work through your own emotions. But that led to a big community now for you. So talk about that. What has that been like?
Yeah, so I started the blog, movingmountainsformotherhood.com. It's like a WordPress. I still have it. It's kind of more morphed into more book information and promotion, but the blog is still there. And the blog, for me, it was emotional processing. It was like the best therapy I could have ever done. I noticed that there was a huge gap when I would talk to people in the infertility community, whether it was on Instagram, TikTok, Facebook, even in real life. There was this gap in knowledge around, like, when should I see a doctor? What constitutes a normal period? Like, what are things to look out for? So I started my blog actually around, like, awareness around, like, female health conditions, and I would cite, like, Mayo Clinic or WebMD or whatever. Now in my book, I have a lot of experts involved to give that credibility, but I would do my research. I would write an article about a condition, and I would put it out there. I was also featuring the real stories of people I was meeting through the community to kind of say, here's the article on PCOS or polycystic ovarian syndrome, and here's a woman who had to go through IVF and had losses or whatever because of that. So that's how the blog started, and then there also started to become more of an emotional processing. Like, when I realized I had to use donor eggs, how do you process and accept the use of donor eggs? Well, like, I'm writing this article while I'm trying to figure out that answer. Like, my blog articles was mental processing on my end, and so I'm helping other people, but I'm really helping myself. So that's how it started. And then I kind of built a community through Instagram. We have over 100 women now that are part of an Instagram chat around just using donor eggs to conceive, all different ages, all different medical reasons. And so they were kind of encouraging me to take the blog to something more concrete, but really it was my mom who said to me, like, Erica, you have over 75 published articles on a webpage. You're going to manage this webpage for the rest of your life. Like, this is good information. You need to put it somewhere that it can live forever. And so when I started to kind of think about, like, what if I just self-published a book and I wrote, like, a table of contents to kind of just get myself organized. That's how I started. And I thought about all the different chapters I had on the blog. And when I figured out, like, all right, I'm kind of talking about, like, who, what, when, where, how. It's like how to get diagnosed, who to go to see to get diagnosed, what it means when you're diagnosed, like, where to go, like, after that, like, how to find your people, and then, like, how to basically, like, figure out what your plan's going to be forward. It was, like, very top to bottom comprehensive guide. Like, that's what I was getting from it. So once I structured it in that way, I mean, I would say about 65% of the book is from the blog. And then the rest of it was, new content I had to create to string it all together. And I did include a lot of experts and people in the book that are not on the blog, but that's really how it started, was realizing I had already written a lot of this content and it needed to live somewhere forever. Well,
you have some at one point you talk about, as you mentioned, third-party donation and the fresh versus the frozen egg donation. Speak to that a little bit, because I've never even heard of that.
Yeah, you're probably like, you're thinking, like, fresh or frozen eggs at the grocery store, and they're, like, really expensive these days. I mean, it's a thing that, like, you don't even think you have to think about. And then when you start to contemplate using donor eggs to have a child, there's actually, like, options. You can have a woman do what they call a fresh donation cycle, where your donor would actually go through an egg retrieval, and they would take the eggs out of her body. Many times this happens with known donors, like a sister or a cousin, someone, or if you go through an agency and there's someone willing to do this for you, they take the eggs out of her body right there. They're fresh. They fertilize them and do a transfer into your body. So that's fresh. And, like, frozen is somebody just chose that they wanted to be an egg donor, went to a bank or somewhere to donated, and their eggs are waiting on ice for you to then come purchase a lot of them. So, like, you even have options of, like, how you want to go about that. There's different pricing structures. There's different, like, anonymous versus known agreements with the donor, and that's also based on, I think, levels of comfortability, values,
Wow, I didn't know that. Yeah.
Pricing, right? There's a lot of options of, like, how you can go about it.
Well, price, it can be very expensive. I think I read it was up to something like $75,000 for, I don't know if that's one time or two. I mean, that's...
Yeah, I mean, we took loans. We were lines of credit to have our son. Like, he's the most expensive thing in my house. Besides the house.
And I just want to say, and I'm sure if you start to follow Erica, her son looks exactly like her, he's a beautiful, beautiful boy, and he looks so much like her. So
we say that it's so weird. It's like he was the baby that I was always meant to have. But
for sure.
Like, I don't think if I used my own eggs, my son would look just as much. I don't know. It's weird. He looks more like me and we didn't use my eggs. Like, it's just, I carried him, and I think epigenetics does have an influence. And I talk about this in the book, but I think some things are just like meant to be. And honestly, I just wanted a healthy baby. I didn't care if he came out with like, people would be like, you want a boy, you want a girl, I'm like, I don't, whatever, like healthy baby at this point.
Sure.
And I get asked all the time, you want more? Do you want to do it again? And I'm like, everybody needs to calm down, because like, I didn't even think I was ever going to have one.
Sure.
So yes, we have more embryos on ice and we'd love to try, but there's no like expectation. This is very like, anything that happens beyond him is like a cherry on top of the cake.
Now, I want you to talk about too, because in the book you talk about the get pregnant quick scams, and that women should be aware of the scams. So what do you mean by that?
So I have over a decade of experience working in pharmaceuticals. I worked in sales, I work now in marketing, and so I have a unique, I think, viewpoint on like package inserts, like clinical studies. I just think that's just the nature kind of like what I do. And granted, I don't work in the fertility space yet, maybe someday. But I just like, I've spent my whole career talking to doctors, understanding kind of what influences like treatment plans and one drug over another drug and market access and all of that. So what I can say is that the fertility industry is a business, as all healthcare is. And I think that there's some amazing doctors, clinics, and companies that want to help people. And then I also think that there is a business-making opportunity on a very vulnerable community, especially the diminished ovarian reserve community, because you'll pretty much do anything to try to have a baby when you find out that your eggs are not in a good place. And you'll take any supplement and do any treatment and do a lot of things to try to increase that egg quality. And what I've come to learn through my experience and the experts I've spoken to is there's really nothing statistically significant out there that's going to help you do that. There are things you can do to enhance odds, but ultimately you don't make more eggs. The eggs that are in your body are degenerating and aging with you.
From the moment you're born.
The moment you're born. And they're exposed to everything you've done, everything you've drank, everything you've eaten, every place you've gone. They're exposed to it. It is not like sperm that gets remade and regenerated. Eggs are a part of your body, and they live and die with you. And so you can't really reverse time. And there's a lot of, there's books, there's supplements, there's things that have become quite popular in the fertility community that, 90 days to fix your egg reserve. And actually a lot of these resources encourage you to put off seeing fertility doctors until you've taken this supplement and waited 90 days and ate this diet regimen and whatever. And it's like crazy, because it's like when you have an ovarian reserve problem, the number one thing you do, you need to see a doctor and get the eggs out now, because time is of the essence. 3 months can make a difference when you're dealing with a super low ovarian reserve. So it's like very counterintuitive. And unfortunately, it's also very patient shaming. A lot of these resources put the blame on this like egg degeneration, if that's what you want to call it, like on the patient, and like it's not. Some people are actually just
human body.
born without eggs. I've met women that have what they call premature ovarian failure or insufficiency, where like they're literally born without eggs, like they don't know. They have no idea. Because you can actually still get like periods if you have like a very low reserve, or maybe like their period was late, like they didn't get a period, or they're 16 and they still haven't gotten a period. They go to the doctor, they're like, where's my period? And they get diagnosed and they find out at a young age, like they were just born without eggs. Wow. Like there are people, and there are men that are just like born without viable sperm. Like there are people that are just born without it. So to assume that every single person, when they become of childbearing years, is going to be able to get pregnant, I mean, it's just a wrong assumption, because like there are people born without it.
Right.
And then there's all the other conditions that will degenerate these gametes over time. So it's just, we're so focused on preventing teen pregnancy and making sure that like, we have teenagers that are like not doing that, but then we're not educating young women and men on the common conditions that can prevent them from being able to actually have a baby in the future, where now would be the time that you would do egg freezing. Now would be the time that you would get a surgery to prevent a condition from getting worse.
Right.
We're so focused on preventing teen pregnancy that there's no education or concern about protecting future fertility of adults. And I hope that a resource like this helps to open some people's eyes to that. Like, I don't think this book is just for someone going through infertility, like we were just saying. I think this book is also for like everyone. If you're a parent and you have a kid, like maybe you should read it, because if your child ever presents any of these issues as a young adult, like you could maybe help them. I don't know. Like I think this book reaches wider than just infertility patients too, because we all know someone going through this. Right. So yes, there's the medical educational aspect of the book, where I have embryologists, doctors, therapists, and fertility experts weighing in, but then I also have the emotional side of this.
Yeah.
And so if you need to be validated and you're going through a hard time with infertility, read this book. But if you know someone that's going through a hard time, I'd argue read the book even more.
For sure.
Because you can really learn a thing or two about what it's like to be in this situation, which I always say, to live it is to know it. Like, you really have to, unfortunately, go through this experience to truly and genuinely understand the weight of it.
Yeah. What you talk about in the book, you advise women to be proactive, and that's, I mean, you kind of mentioned it, but because I think there's a common, like, oh, you figure it out when that time comes. But what would you advise women at this point, to just get checked? At what age,
So if you're presenting any symptoms, like if you have a really painful, debilitating period, or you're skipping periods, I believe the definition is like, if you haven't had a period for 35 days or longer, that would be considered a skipped period. So if you have any abnormal menstrual cycle symptoms, see a doctor at any age. See a doctor at 16, see a doctor at 21. Like, see a doctor and bring up these menstrual cycle symptoms, because then you can get tested, you can possibly have early diagnosis, and then you can have options for fertility preservation. If you're beyond that and you are older and of childbearing years, or with a partner, or you're thinking about kids, or you want to have kids, there's a couple things you can do. The first thing you can always do is bring up to your OBGYN that you're interested in just being tested, your hormone levels, your egg reserve, your partner's sperm quality. Those are things that you can just call a fertility clinic and ask to do at any time, and it's covered by insurance. Most of these things are blood work. It's covered by insurance, sperm sample.
But that's not typical for, I don't feel like most gynecologists suggest that, really, right?
I think it's becoming a little bit more commonplace now because of how much more infertility is becoming commonplace, but I do think you have to bring it up. You do. I mean, if you go to the gynecologist and you're there for your annual visit and you're like, hey, look, like, I'm 35 and I don't have a partner yet and I think I might want to have kids, or me and my partner have been having unprotected sex for more than a year and we use the pull-out method, if you will, and I'm still not pregnant, so what does that mean? I mean, those are two examples of somebody that should go to a fertility clinic. Right. The woman who's 35 that's aging and doesn't have a partner yet but may want to have kids someday, that's totally valid. And even if you're younger than that, honestly, totally valid to see if you can have your egg reserve looked at to talk about potential egg freezing options. And the younger you freeze your eggs, the better off your eggs will be. So I have friends in their 20s now that are exploring this just because of the sheer fact that they're getting close to 30, they don't have a partner, and they want to be proactive. I also discovered on my own during when I went to see my fertility doctor that I had been experiencing infertility for a decade and didn't know, because I thought that trying to get pregnant meant peeing on an ovulation stick and wearing all the jewelry and taking all the supplements, and that's actually not what it is. It's straight up just having unprotected sex. If you're not on birth control, if you're not using a condom, if you're not doing these things, the pull-out method doesn't count. It's only 15% effective, and I do cite all of this information in my book. But if you're doing that statistically over a certain amount of time, you actually should get pregnant, because that's actually not a very good use of birth control. So if you are with a partner, say for 10 years, and the whole time you've been with them, you've basically never used protection, but because you're pulling out and not having sex on ovulation, you think you're preventing, that's actually infertility. And I didn't need to wait for a year of trying to see my doctor. I could have just went, because we had been doing that and weren't getting pregnant. So that to me is one of the most shocking things that I learned in my experience. And I want that piece of information to be, crystal clear in my book, that a lot of people are probably experiencing infertility and they don't realize it, and they don't have to wait.
What's the best advice you've gotten in this whole journey? That's a tough question. Probably you probably got so much. I mean, in the book, there's so much. That's such good stuff. But what's maybe something someone said that really stuck with you?
I was in a lot of group therapy around using donor eggs and genetic loss and all of that. And I think, actually, the best thing somebody said to me was my father. I'm going to actually quote him, because of all the therapy I did, he said the best thing. He was basically abandoned by his father when he was young. He never really knew him. He left his mother and never really was seen again. And he always said to me, Erica, I would pick a non-genetic parent who was there for me and showed up at my baseball games and was with me for my life than the genetic parent that abandoned me when I was 10 years old. He's like, that to me was everything, because it really helped me accept genetic loss, to look at it as okay, me and my son may not share this genetic piece, but we're always going to I'm always going to be his mom. I'm always going to be in his life. I am his mother. And I think that's true of anybody, people that are adopted or people that have to go through these different like ways to become, a parent, and to, there's so many ways to have a family. The genetic piece, really, when you think about it and you think about people that have good relationships with their family, it's not because we're blood related. It's because they treated me right and they were a good parent, and because of that I love them. And it's not because we share DNA, like, right? And I had to think about that. Like, I never think about my parents' DNA. And if I found out tomorrow that like my mom wasn't my genetic mom, like, yeah, I think she should have told me. I think transparency is important, but it wouldn't. It's just not matter. Like, it really doesn't matter. That's not what makes the connection.
Exactly.
That to me, I think, was when my mind shift started to change.
You, we have about a little over a minute and 50 seconds, but you, in the book, you talk about writing a goodbye letter to your genetic child. That's, you recommend that women do that. You had to do that, and that must have been very difficult.
Yes. So that was an exercise I did in a group therapy session that I recommend to anybody, because I think in order to welcome something new, you have to grieve. If you don't grieve, you're not going into that next chapter with the right mindset. So that was a grieving exercise that really helped me.
Oh gosh, Erica, you've been through so much, and now you have a beautiful, beautiful baby boy. I want to say this: you end the book with a poem you wrote, and we were talking about it in the break. And you've never said it out loud. You've never spoken it out loud.
I've had other people read it, but I can't read it because I'll cry.
But here it is in part of it, and I'll end on this. You say, quote, "I wouldn't wish this journey on anyone, but if it has to be you, then know this. Hard setbacks make for stronger comebacks, and you will soon have your baby to kiss." And I thought that was just a beautiful, beautiful thing. And who knows what the future holds. And I think, as I said before, I'm pretty good at calling things, and I can see this as an international bestseller because you were helping women, you are changing their lives. So anyone who can pick up this book. It's called Moving Mountains for Motherhood, a guide to survival and to survive and even thrive through your infertility journey. All right, that's all for us. A big thank you to Erica Ferraro. Her book will be released shortly. Thank you for coming on the show, Erica, and sharing your story and having this very important conversation. You have been listening to Secrets of Powerful Women. Head to Powerful Women USA or Spotify to listen to previous shows. You can connect with me on Instagram. I'm Jill Conway. Thank you for listening to the show, celebrating incredible women. I hope you are inspired to pursue your goals, believe in yourself, and dream bigger. Your voice matters, and your story can help others. I hope you join me next time.